everybody. This is Jessica Zeff. I'm the Director of Product Compliance here at NetHealth. Welcome to the last of a three-part series of vlogs on the topic of information blocking and information sharing. Now, in our last vlog, we defined information blocking as intentionally withholding or making it difficult to access patient information when it would be otherwise acceptable to share it. And this assumes no HIPAA issues and no exceptions under the 21st Century Cures Act. We also looked at the information we have to share under the 21st Century Cures Act, namely what's called the USCDI data elements and electronic health information, or EHI. And that's what we covered in our previous vlogs. So now let's go on to our next discussion. Okay, so we know we have to share patient information and we know what information we need to share, but how do we actually share it? This is our third and possibly trickiest step on the road to the future of information sharing. Healthcare providers across the country use all kinds of different EHRs to hold patient information. And most of these systems are built using different kinds of computer or electronic coding language. Think of someone who only speaks German, another who maybe speaks Swahili, and another who speaks Vietnamese. So these are three different people whose individual languages enable them to communicate in their home environments, but who can't communicate with one another because they all speak different languages. Well, I like to think that EHRs work similarly in that regard, and that they're great in communicating in their home environments, but not necessarily with one another. This makes the communication of information between different healthcare providers involved in a patient's care difficult, if not just downright impossible, and has implications for the safety and effectiveness of patient care. It also poses a challenge for information sharing because, if you can't share the same language, you really can't communicate. But alas, there is a solution, and it's called Fast Healthcare Interoperability Resources, or FHIR, as some of you may know that phrase by. And the easiest way to explain FHIR is to describe it as a programming or a coding language. But it's a universal coding language that can be used to enable different EHRs to communicate with one another. Going back to our three international speakers, it would be as if suddenly each speaker could speak their native language, right? And they could suddenly speak English. Now, the group would then have a language in common and could communicate. The same principle applies here. FHIR is the common language that, when adopted, would enable the sharing of information between healthcare providers, payers, and health information exchanges. Of course, subject to any HIPAA requirements, right? But the point is that there would be a common language for this exchange of information. And imagine what it would be like to have a complete picture of a patient's care and treatment, all the information coming in when you need it. Imagine a world where good care coordination is available at the touch of a button. And imagine the possibilities for robust analytics, which would enable more tailored approaches to individual care and more informed strategies for population health initiatives. How amazing would all of this be? So FHIR would also enable increased information sharing with patients. Now remember, the information sharing rules that we've been talking about don't just apply to sharing information amongst healthcare providers and different healthcare stakeholders. They also apply to sharing health information with patients. And why is it so important to use FHIR specifically to share information with patients? Well, this brings me to my third and last point. Remember, FHIR is a universal coding language. Universal means it's used in a variety of electronic applications software, and devices in healthcare. But it's also used in banking and in so many of the other applications that we all use on a day-to-day basis. It really is a universal coding language and not just used in healthcare. That the coding language can communicate with such a wide range of electronic devices is really important because the information sharing rules in the 21st Century Cures Act mandate that health information must be provided to patients in whatever format they request, subject to defined exceptions, of course. But this means that if a patient asks for information to be sent to a health application of their choice, the provider needs to make every effort to honor this request. And FHIR can really make this happen. It can make it much easier to honor that patient's request. Imagine being able to share with or receive from a patient's wellness device or application. For example, information about blood pressure monitoring, heart rate, ECG. That's all possible at the minute. It's coming out if it's not already, out in the ether. But just imagine what providing healthcare will look like in the future. It really is, on the one hand, a bit scary, I suppose, and on the other, super, super exciting. And that really concludes this three-part series on information blocking and information sharing. I hope these sessions have helped you to understand more about the 21st Century Cures Act and the effect it's having on our industry. Once again, thank you all so much for listening in. It's been a real pleasure.